welcome to Your Health, where we explore the latest in health across the country. I'm Erica Cardenas. Today we're here at Floo-id Yoga to talk about self-care and self-improvement month. But before we get into our best yoga pose, let's take a look at what's coming up on the show. We talk about the benefits of yoga and what it can do for your well-being, and new ways your kids could be getting their hands on dangerous drugs. Plus, a group helping their community gain access to quality health care. All that and more in this episode of Your Health. Putting our health first should always be top of mind, especially during Self-Improvement Month. And joining me now is Beth Berry, owner of Floo-id Yoga, to tell us about how yoga can improve our well-being. Beth, thank you so much for being with us.
Thank you for having me. I really appreciate being here.
First off, what is Floo-id Yoga?
So Floo-id Yoga is a creation of mine. I've been teaching yoga since 1999, and I kind of left the community that I had graduated in and decided to do my own thing. And so I put together some hot yoga. We've got hot Pilates here, hot fusion. Everything's heated. So if you like the heat, you'll love Floo-id Yoga. And it's just an amazing way to share health and wellness with others. You know, I see people come in all the time and heal themselves. So it's really neat.
So tell us a little bit more about your classes.
Everything that we do here is active, meaning that you get a workout, so you burn calories and you detox and things like that. The Pilates we've been doing here for about 3 years, and it's totally changed my body because I've been doing yoga for over 20 years, and it just got to the point as my age, as we get older, things tend to not be the same the way they were when you were 20s. So I incorporated the Pilates, and it's just really helped me tone and firm and get a little bit more tight. And then the yoga is still a great complement because I still need the distressing and the relaxation.
So now, for those who can't make it in person, you also have online classes, right? So tell us about those.
Right, so during 2020, we went online and we were filming classes. This was actually our filming room for our sessions. And we have a huge video on demand library of all these sessions. So from anything from relaxation to active, from the Pilates to the yoga, we've got yin on there, we've got meditation, things from 7 minutes long all the way up to an hour and 15 minutes. So it's over 500 videos on our video on demand library.
Now, Beth, if someone doesn't live here locally, how can they access the video library?
On our website, we actually have a video on demand login at the bottom right, and it's a week free. So if you want to just do this from your house, because a lot of people still do that right now, you can log in, get a week free, and then sample all the different sessions we have available.
So this is Self-Care and Self-Improvement Month. Tell us, how does yoga improve our well-being?
It's a big question. So yoga really just, I think people come to yoga for so many different reasons, right? So some people come to lose weight, some people come to de-stress, some people come because they have high blood pressure, some people come because their doctor prescribed them yoga and said you need to go in, some people come to heal an injury. So all of it works, and it sounds, I guess, to people that don't practice yoga like, oh yeah, like it can encompass everything, but it really can. I think people come and they get what they need from it. It really just helps you be more present in your body and more aware of the things you say and do.
Let's touch a little on mental well-being.
Yeah.
How can yoga improve in that area?
We carry so much stress these days, and we're always being, our phones are ringing, they're in our pockets with us, all the emails and everything like that, and I think we're always on. And when you go in that room for those 60 minutes, you turn everything off. And our sessions are guided with a trained instructor, and so you don't need to be on. You literally just can be in the moment, present for 60 minutes. And how often do you, unless you meditate, do you even some people don't even take a minute or two in their day to just be focused on themselves, focused on their breath. And then we take a full hour. So when you give somebody an hour of time to themselves just to reflect on just themselves and work on their body and work on their breath and relax, I mean, it's really life-changing.
Now, Beth, any last advice you have for someone, say, who wants to try yoga but might be a little hesitant?
The great thing about this community is we're very welcome. I mean, we have people all shapes, all sizes, all color, all ages. So anybody can do it. It's just a matter of your mindset. You really just need to say, I'm gonna do this, I'm gonna make myself better, I'm gonna de-stress, I'm gonna go in and take care of my body, because a lot of us, and not just our body, but our mind, it's not selfish to take care of yourself. Everybody can benefit from it.
Beth, thank you so much for your time. Such great advice. If you'd like to learn more about Floo-id Yoga and their classes, just head over to their website. Social media is a big part of our kids' lives, but it could also be a way for them to get drugs. One group is making it their mission to educate parents about the dangers of today's drug trends.
Ethan is this young man who would light up a room. He is kind, loving, funny, strong, compassionate, and had a heart for service. He was a pure joy to be around. When things got challenging, he was always said, "Mom, there's a purpose to this. There's always an opportunity, Mom." And we've got to speak about that. That was Ethan's heart. Ethan died February 16th, 2019. He was at home, and I found him in his bedroom looking like he was still sleeping.
What we're seeing right now in Arizona is an alarming number of teenagers overdosing and dying from these counterfeit pills laced with fentanyl. In fact, in 2020, 14 children died from opioid overdoses and like these counterfeit pills laced with fentanyl. So right now it's critically urgent and important for us to be talking about this issue. Most of our teens are getting access to these pills in a couple of different ways. We do know that they're using in groups and social settings with other friends. So that's one of the ways that they're getting them. The other two key areas are through text messaging and through social media apps. Offers come to them on their phone and they'll see ads for those selling pills or selling marijuana. And we've seen a number of cases where that's where our kids are getting access to these pills that have killed them is via social media apps or text messaging. It's really difficult to stay on top of technology all the time. And that's one I always say, talk early, talk often, and be there at the crossroads for kids if and when you can. And being at the crossroads means after school, it means at dinner time, it means when they come home from a date or come home from a party. There has to be a conversation, yes, about the substance and the technology, and I think that's really hard for parents because if a child is using, the earlier the intervention, the better the outcome for that child. One of the most important things that parents can have in their home is a medication called naloxone. What naloxone is, it's an opioid reversal drug. What happens with naloxone is it can be just a simple nasal spray. Once you put the nasal spray into the nose, it immediately brings that person back to breathing, their heart starts pumping, and they get a second chance of life. Naloxone should be in everybody's medicine cabinet because a lot of times we think as parents, not my kid, not my neighbor's kid, not my friend's kid. So just take that prevention step and have naloxone in your home, especially if you have young ones or young adults. Everyone's invited to go to talknowaz.com. There's all sorts of great resources on there about fentanyl and naloxone. And also just remember that there is hope and help with healing. If you suspect a loved one has a substance use disorder or is using these fentanyl pills, there's a line that you can call 24/7 and get them into treatment right away.
A friend of mine said, when I started this media campaign, she goes, your strongest advocate will be right to your side. And that is so true. That is my son, Ethan.
One way to practice self-improvement is to cultivate gratitude. Research shows that incorporating a gratitude journal into your daily life can help ward off stress, improve sleep, and give you a better mindset. I'm so grateful to show you what's coming up next on the show. A way to get dental care at little to no cost, and a health center in San Diego providing the community with critical care. If you're in need of dental care, you may want to contact Simply Implants Institute. They're a world-class training facility that provides patients with quality care at little to no cost.
If you're shopping around and looking for that right implant for you, or you don't even know what an implant is, look no further, right? Simply Implant Institute is where you want to be in terms of care. We have some of the best faculty members, well-trained, over 100 years experience between all of the faculty members. And so when you're coming here, you know that you're in great hands.
We provide a place where if you want to be a patient, you can actually come and get top-of-the-line implant dental treatment. Now, one of the things we love about this is all the instructors that are with us, they actually been doing implants for many years. In the Institute, it's primarily all the surgical work, but it's up to you to decide ultimately what you want, whether it's a denture, which you take out in and out at night, or whether it's a hybrid type of denture, which we take out once a year, or if it's a fixed bridge work, where basically you never have to take it out at all. We don't push any certain treatments on you. We want to find out what's important to you, what makes sense to you. During the screening, we see what is your bone is like, what is your teeth. We find out all of these things and we say, you know what? Usually we have approximately 3 categories of way that we can get you fixed up. Perhaps maybe there's 2 that actually will work. what makes sense to you? What is actually going to work? You know, if you don't have to lose all of your teeth, but you still need some implants, we can show you some ways we can get your smile right back to where you might want it to be.
Find out the alternative and options that are available in implant dentistry, because there's a lot of practices that are not really focused on everything. And implants is one of those fields that you can have alternative choices, you can stage things, so the client ultimately gets what they're looking for. While we all know that implant dentistry is expensive, a lot of people are confused about implant dentistry, like, oh my God, the cost. Well, as I said before, the cost in implant dentistry can be very affordable for some of the smaller options like immediate dentures with implants, all right? And we have different options available for people that are losing all their teeth. Here at the Institute, what we do is restorative training, but we're a surgical course. And you know what is crazy as heck? It's actually completely free, complimentary, and actually nothing in life is free. So where's that money coming from? Well, it's the doctors paying us good tuition to give you a complimentary service. And people are like, is there something catch? No, not at all. So you pay for the denture, for example, we'll do as many implants as you need for the overdenture. The only thing that a client is responsible for is paying for the denture. So everybody watching this video that is considering doing implant dentistry, if you want to get informed about an alternative or choice that will change your life, then I invite you to come to the Institute, get the information you need so you can actually help yourself make a good decision by being completely informed in the world of implant dentistry.
In honor of Hispanic Heritage Month, we spotlight a community health center that's been serving its community for 52 years and was started by a group of concerned moms.
So the mission of San Isidro Health is to improve the health and well-being of the communities we serve with access for all. And that really says a lot, because what it says is we do not turn anyone away in the 47 program sites where we operate throughout San Diego County. So we have 108,000 lives in our care, and we're able to offer many working families in underinvested areas medical, dental, and behavioral health services that are needed now more than ever.
For the most part, do serve a lot of the underserved populations. A lot of the need is more of your health maintenance or chronic disease management. Based on the health disparities in the communities we serve, they tend to have a higher rate of some of the chronic diseases such as diabetes and hypertension.
Started with a group of 7 founding mothers that organized because the only doctor in San Isidro at the time was going to leave to go work in Chula Vista. So instead of giving up, they actually organized and founded a little clinic in a little white house that was volunteer driven. And who would have known 52 years later that we would be where we are today?
So it was no surprise to us when the pandemic hit that our population was hit the hardest. So we were seeing rates in our community 4 or 5 times higher than the rest of the county.
We, throughout COVID, have been extremely fortunate to receive so many generous donations to help us meet the need at hand. Many of our communities where we live and operate were experiencing COVID 4 to 5 times higher than the rest of the county. So we stepped in right away and provided not only COVID kits, where we were able to supply families with a thermometer, hand sanitizer, as well as other products to make sure their home was safe for the entire family. We were able to raise nearly $800,000 for our COVID relief fund, many of them from first-time donors, and we don't want to lose that momentum.
So it wasn't just one site where we treated COVID patients. There was a period of time where we became a monoclonal antibody regional center for COVID treatment, which is the outpatient treatment. We've always seen our role not as just providing services, but really advocating for our patients. And so we knew that we needed to provide the education, the outreach, the resources for our patients so they understood not only the disease, what they were facing, how to keep themselves safe, and then how to prepare for the vaccine. We played a big role, I think, in the vaccination efforts. And while early on, we were seeing our numbers of infections 4 to 5 times higher than the rest of the community. Now we're seeing our vaccination rates the highest in the community.
We were able to bring the entire region to a healthy level that allowed us to open up and start that recovery process. And that, to me, there's such a life lesson there. That's how interdependent we are. So what's good for San Isidro Health really is good for the rest of the region for us to thrive.
Another way to practice self-care is to be kind to yourself. Instead of being self-critical, offer yourself empathy and understanding. This kind self-talk can have a huge impact on your outlook and mental state. Stick around, here's what's coming up on the show. An organization offering a helping hand to expecting mothers, and how you can treat the pain of neuropathy. A lack of resources and education for pregnant women is at the heart of what Save the Storks is about. This organization is trying to bridge the gap for expecting mothers.
Save the Storks is an organization that equips pregnancy resource centers across the nation so that these pregnancy resource centers can reach more women facing unplanned pregnancies and provide them with holistic care, compassionate choices, and just an abundance of resources to support their decision to choose life. A lot of women, when they are faced with unplanned pregnancies, they often are decision vulnerable because they don't know of all of their choices. In that very immediate moment, they may think there's only one option for them to move forward. We believe in choices, and what that means is allowing them to actually have all of the choices and all of the options and all of the guidance so that they are able to make an informed decision. Save the Stork has been around for about 10 years. Most people know us by our stork buses. A stork bus is a mobile medical unit that's equipped with the state-of-the-art medical equipment as well as very knowledgeable and experienced medical professionals. They offer pregnancy tests, ultrasounds, and also STD tests.
The buses enable them to reach areas, especially in rural areas, I would say, where maybe there's not a pregnancy care center nearby. And so these buses are able to go into those areas and provide the services that women maybe aren't able to get to. So I'm going to tell you a story about how the bus was available for one young girl. She was 16, she was pregnant, and it was very shameful for her family. They ostracized her, the boyfriend left her, all of her friends ostracized her. She was all alone, and her mother was asking her to get an abortion. She was going to the beach one day, and she saw our mobile unit, and she came up to the door and she said, "Can I please see my baby?" We did an ultrasound for her and found out that she was about 16 weeks along. We eventually was able to get the mom to come with, and the dad and the boyfriend. We got everyone together to come and do another ultrasound where they could all see. When her mother, who was encouraging her to have an abortion, saw this baby, she immediately started to cry. Everybody was in tears. She said, "You know, my family, each of us, we were all living for ourselves. We were all doing our own thing, but she said, now we all live for my daughter." So to me, that is the perfect example of what having a stork bus in the right place at the right time can do.
Sometimes another woman just needs to be inspired by another woman, and we can definitely empower more women by coming together and showing her and allowing her to understand that she is actually so much braver and so much more courageous than she gives herself credit for.
We are here for you, 100%. We are here to walk this journey with you so that you're not alone and to help you find your heart in all of this. And that means and that you're going to make a choice that is truly going to be something that years from now you're going to be proud of.
Don't go away, we have more coming up on your health from Floo-id Yoga after this. Innovative treatments to help with the pain of neuropathy. It's estimated that 20 million Americans suffer from neuropathy, and the doctors at True Health can help your symptoms with their innovative treatments.
So neuropathy is actually more common than we think, and it is nerve damage. So there is over 100 reasons to why neuropathy happens. There is diabetic neuropathy, there is chemical and medication-induced neuropathy. There is also idiopathic, which means we don't know why it happens. But regardless of the reason, we need to know why it's happening and how to treat it. Over time, as these nerves are damaged, they cause patients symptoms like tingling, burning, cramping. Patients are not able to sleep. So with time, this can take a big toll on patients' quality of life. It's very important to treat neuropathy without medication because the medications are simply designed to mask the problems. So as we continue to mask these symptoms, they're just going to get worse. And a lot of these medications, they actually numb your brain, which means they numb the pain. They don't do anything about the root cause of the problem. Our most successful patients are ones that are highly motivated. They don't want the pill for an ill formula. We are the type of clinic that will work with people who are highly motivated to get better. In doing so, using these FDA-approved, groundbreaking treatment modalities, we're able to remarkably see patients do better. Our patients actually do really, really well, where we're able to see these symptoms go away because your body can heal. Your body can heal and wants to heal without medication.
Once the regimen was established, I felt comfortable with it, and I have shown nothing but marked improvement. When I first came in, it looked like this. Now that I'm completing my treatment, this is what I look like. Prior, I was experiencing neuropathy and cramps during the night. I couldn't sleep all night. Presently, I can sleep the whole night. I'm walking without a cane, and my quality of life has vastly improved.
So when our patients come in for nerve damage screening, we do a touch-based exam because these patients have been poked and pried so many times, so this is completely pain-free. This is one of our very severe cases, and you can see that because of the many areas that they have complete black. Black is total loss of function. You can see that just few short treatments later, they went from this to this, and this is how we know that they are actually progressing and then they're improving and their symptoms are going away. At True Health, we pride ourselves in treating all patients like family. So we bend over backwards for our patients. When they come in here for treatments, they want to be here, they love coming here. We have a location here in Chandler, Arizona. We're also located in Scottsdale. And we are ready for you to come in, again, for that free exam and consultations where we can go over your symptoms, see if you make a good candidate for the treatments that we have. We are ready for you. Let's get your quality of life back. You have nothing to lose but your neuropathy.
We want to thank Beth and everyone here at Fluid Yoga for having us out today, and thank you for joining us on Your Health. I'm Erica Cardenas. Stay well and see you next time.